open finance and data, and a series of articles and podcasts featuring, among others, Professor Sandy Pentland, the author of Social Physics, Jamie Bartlett, the author of People versus Tech, and Professor Shannon Valler, who is the new Baillie Gifford Chair in the Ethics of Data and AI at the Edinburgh Futures Institute. So please keep an eye on the DDI website over the next couple of months for these articles and podcasts. Today's discussion will be recorded and shared on the DDI site. And if you have a question for our panelists or any comments to make, please click chat and click the arrow to select Steph Q&A. Stephanie Peebles from the DDI will be monitoring the questions and flagging them up to me. If you want to tweet, please do so. We don't have a hashtag, but just tag in at @DataCapitalEd if you want to make any comments on Twitter during the course of the discussion today. So to introduce our panelists, we have John Godfrey, who's Corporate Affairs Director at Legal & General, which has committed £20 million to fund the Advanced Care Research Institute, which is a 7-year research programme with data at its heart, with 25 new researchers starting in September and working closely with the University of Edinburgh. We have Paul Lawrence, who is the Executive Director of Place with the City of Edinburgh Council, and someone who's been a significant driver in the City Region project. Our other panellists today are recipients of grants from a funding package of almost £250,000 allocated by the DDI to projects using data-driven innovation to support communities, services and businesses in the City Region to respond to and recover from COVID-19. They are Andrea Wilson from the Roslin Institute, who is leading on a project on data-driven nowcasting and forecasting of healthcare resource requirements associated with COVID-19, and Alessandro Rossiello from the University of Edinburgh Business School, and Matt Vidmar, a research assistant, who are working on the impact of COVID-19 on high-growth businesses in the City Region and beyond. So welcome all. COVID-19 has highlighted very much the importance of good data practice, whether that's collection, whether it's storage, whether it's analysis, and whether it's the use of data for statistical reporting. We have seen some positive developments, and we've also seen some criticisms. Obviously today, as many of you will have seen, the BMA have accused the UK government of being far too slow in sharing data on the kind of emerging spike in cases in Leicester, which they claim could have led to swifter action on the new lockdown in the city. So what, first of all, has COVID-19 demonstrated about the strength or otherwise of our data recording, storage, analysis and practical use of data? Paul Lawrence, first of all, how would you assess in Scotland that local government has coped with data, both in terms of how you work with other local authorities, but particularly how you've worked and cooperated with Scottish Government and with health boards?
Sorry, I'm just trying to unmute. Can you hear me okay?
Yeah.
I'm not sure I can answer your specific question around the local government health board data sharing, because it's colleagues of mine that have been dealing with that on a day-to-day basis from as kind of observing inside, as it were. Actually, I think although some of that process took some time to get up and running, as we've moved forward, the kind of way in which data was collated, shared and deployed has actually had a lot of positive elements to it. My concern, I suppose, is a broader city management concern, if I can call it that. And that's where I think we've got something of a problem. I think we were particularly weak at collating data and deploying it on, if you like, if I can call it this, how cities function. And I suppose the most obvious place that's seen is in the transportation space. But more generally, what I might call the rhythm of the city. We kind of knew, how universities worked. We knew how transportation system worked. We knew how the retail system operated. We knew how offices worked. But we never kind of collated that data together in an intelligent way. That's now been completely transformed to a point where we no longer know how any of those, for want of a better term, urban systems work anymore. we don't know, unless some colleagues on the call might do, about how universities are going to bring themselves back together in terms of the teaching of students, for example, and what that looks like. And so that kind of understanding of the new urban dynamics and collating data around that and then deploying it to inform decision making, I think that is a significant weakness, but a significant opportunity. I suppose that's the area that I would really like particularly to focus on today.
Okay, thanks, Paul. John, I'll just come to you. I just wonder, you know, with Legal and General getting involved in the Advanced Care Research Centre, whether you've got any observations on what you've seen on the care homes in particular and that relationship between kind of care homes and NHS, and how that kind of data sharing has looked to you.
I mean, I think the first and obvious observation is it's been a real tragedy, actually, what's happened in some care homes. And what the data seems to tell us is that where the COVID epidemic has got into a care home, the results are catastrophic, but it hasn't got into all care homes. So it's quite a mixed picture, and we need to understand that rather better. I mean, the work that we're sponsoring in Edinburgh was designed really to be a longer term project, and we set this up before COVID. And I think what's happened with COVID is it's made it rather more urgent, and it's underscored the importance. And so there's a lot of things that we can take from this, which had we done this 7 years ago, as opposed to starting now on a 7-year program, would have put us in a better place. And, you know, one of the things that really strikes me about this is how you pull together disparate medical records. And of course, Scotland is better at that than the rest of the UK, but, you know, everywhere is capable of improvement. And then how, for example, some of the really tricky technical underlying points are dealt with. So, for example, natural language processing in medical records, how do you work around that? And how do you cope for medical records which talk about things like frailty, which are not specific medical conditions in themselves, but tell you a lot about the individual that you're looking at. So I think a lot of those things a work in progress. Hopefully, we will all make a lot of progress ahead of whenever the next similar event comes along. But this has given us more urgency around the work that we're doing with Edinburgh.
Okay, Andrea, I'll move on to you. Could you tell us a little bit about your project that you kickstarted relatively recently during this pandemic, and what you hope to achieve and what's been achieved so far?
Right. So the aim of the project is actually to get a better understanding to predict the hospital resources that are required in the future. So put yourself back to the beginning of COVID. We all had this picture of completely overcrowded hospitals in our minds, and the government reacted quickly, and, you know, hospitals were closed, hospital wards were closed, because we were so frightened that we couldn't cope as a nation. And in essence, actually, the opposite occurred, right? So it was underusage of hospitals, and neither situation is ideal. So it demonstrates very well, in my mind, how without data, you cannot predict what's going to happen. And yet it is vitally important to have the right resources at place at the right time. So this is basically what our project is about. We're trying to pool all the relevant data together to make predictions, forecast predictions in the future, where hospital resources will need to be mobilized quickly, because we are expecting that second outbreaks will occur in different areas quickly over time. And as you referred to in the beginning already with what happens in Leicester, it really demonstrates that you need to act quickly.
Okay, thanks very much. We'll come on to that, maybe that need for speed in a while. Matt, I'll come to you. You know, we're looking at a different area here. We're looking at high growth businesses. Can you tell us a bit about your project with the high growth businesses and the data that you've harvested there, and how that might be helpful in future in helping the economy of the Edinburgh City region and beyond?
Absolutely, and well, good afternoon, everyone, and thank you for having us. So it's, you know, our engagement with data is really twofold. On one hand, as you mentioned, we are harvesting quite a lot of data, working with high growth firms to understand their response to COVID, as well as their strategic decision-making to get out of COVID or to try to reboot their businesses and continue on their growth trajectories. And to do that, we kind of have a 4-part approach. We are developing a bespoke data set of over 500 UK businesses that we're tracking, including quite a few in the Edinburgh City region. And we'd like to develop a longitudinal study that will follow their, we've already issued a big survey earlier this year, so in April when just the COVID started. And then we will follow that up with further surveys later this year and next year. And so there's a database that we're also merging with other databases that are already in existence, like the Bowhurst commercially available database of fast growing businesses in the UK, as well as research databases like FAME. So we're trying to collate a super database of all three, including having developed an algorithm to try and actually script the data and manually extract different parameters. So we automatically extract different parameters that so far we only be able to look at individually and manually. And furthermore, we're trying to develop intelligence around which questions should we actually ask of this database. And that's why we're doing a series of qualitative interviews that I'm sure we're going to get back to, because actually a lot of the findings from there are very relevant for this discussion, in particular, because not very surprisingly, in the way the UK economy has been developing over the past few years, a lot of these high growth businesses are actually data businesses. So we're not only building a big database of information about high growth firms, but we're also directly trying to help high performing data businesses to try and make the best of the situation. And as you've pointed out, there's actually quite a few opportunities there, not just challenges. So we're looking forward to actually develop a more comprehensive analysis of what actually data businesses are able to do in this situation.
Okay, thank you. What have you, sorry, Matt, just to come straight back to you there, what have you kind of found? What you were doing with the research was at the early stages of the pandemic. What was that immediate reaction from those high growth businesses? What were you getting back from them in terms of how they felt? And also a point you raised with me when we were chatting earlier on today, did they feel that they have enough information? It comes back to this, the need for speed in sharing data, but also sharing broader policy information. You suggested that those firms maybe didn't feel that that policy information about COVID-19 was communicated quickly enough to them.
Yeah, absolutely. So it's a very interesting situation. It's a mixed bag in terms of what they felt. And I think Alessandro can actually explain a little bit further, because we have a sister study that looks at self-employed professionals as well. And there's an interesting dynamic at play there as well. To begin with, there's of course been a bit of a shock in terms of what does COVID actually mean for business operations, as well as of course key performance indicators like, are they going to get any cash flow at all? Because customers might be shutting down or slowing operations. So there has been quite a lot of quite a dramatic drop in things like cash flow and confidence around cash flow and kind of key business performance indicators. On the other hand, these high growth businesses were actually in a relatively good shape. They had a relatively significant amount of investment that backed them, and they were actually quite optimistic. Only 6% of entrepreneurs that we've actually surveyed have reported that they are really having serious concern about the closure of their business because of COVID. So actually most of them were quite optimistic about developing businesses forward, even though it may be a different way. And this has been borne out in the subsequent sort of qualitative analysis we've done. We've spoken to quite a few of these firms in the city region and beyond. And what we found out is actually quite a lot of them use this as an opportunity for learning and growth. And here I think comes that point that you've mentioned, David, which is that they felt a little bit frustrated sometimes with lack of information coming from government, because these firms were trying to reorganize the way they actually do things. First of all, of course, move to home working, but many of the data-intensive manufacturers were also looking at how can we keep the manufacturing operation running, or at least, kind of at least hibernating in a safe way, as well as how to restart it now. And they have, well in advance of government announcements and policies, had to come up with both testing out pilot solutions to how they can deal with things, as well as propose health and safety measures that we're going to introduce going forward. So in a way, actually, they were a step ahead of the government often, which is quite frustrating, because clearly the government has resources at its disposal to collate and collect a lot more data. And these business entrepreneurs and business owners were trying to sort of deal with these challenges with very limited resources, unlike the government.
Okay, thank you. Paul, just on that point of kind of, you know, the data sharing issue, the need for speed, but also sharing policy and whatever. How do you feel at Edinburgh? You said there's a lot to do in terms of joining those data sets together and understanding what everybody else is doing and where the data joins together. Do you feel that kind of overarching kind of framework is in place at governmental level? Are we starting to build a data infrastructure across Scotland that can help to move forward in the way you've described?
Probably not is my slightly depressing answer to that. But I'm not sure across Scotland is the right place to do it. And funnily enough, I was having this conversation with some university colleagues the other day. The key thing for me is to have a kind of an innovation architecture within a place. And generally, in my experience, that kind of architecture best works on a city or city region basis than across a broader geography. To have a kind of innovation architecture or system which works across the whole country, it would be over ambitious and unlikely to succeed, in my view, other than at the very macro level. But I think at the city and city region level, to have exactly the kind of infrastructure that you've heard about a moment ago as to what policies are in place, what data is in place, and what policy questions are we trying to answer. I'm not sure that that's clear. I think we've got some tremendous attributes as an innovation ecosystem within Edinburgh. We've got some extraordinary companies, some remarkable research, terrific resources, and some great facilities. The incubator at Coburst being, for example, a very good example. But I think it's something of an accidental ecosystem rather than a designed ecosystem, if I can call it that. I think sometimes the way in which people, businesses particularly, understand policy, understand what's going on elsewhere, is a kind of a people bumping into each other kind of infrastructure rather than something that's more systematic. And I think the demands of the environment now are to move, if you like, from that accidental ecosystem to a much more structured and designed ecosystem to make sure that whether it's startups or high growth businesses get the information on policy and on data infrastructure and on investment, frankly, that they need in a much more structured way. I think you can only really do that at a city region level. Of course, there's national level policy that's important, but people like me can translate that or bring in national level officials to give briefings as appropriate. The key thing is to have an architecture where everybody feels they're getting what they need.
Okay, thanks, Paul. And just look a little bit about maybe some examples of innovation that we've seen during the current crisis. Just before I come to you, Andrea, there are there's a whole range of areas that have been given grants for data innovation by the DDI, covering all sorts of things like vulnerable groups, hospitality sector getting back into shape, tourism, local food systems, short-term loans to help those on benefits, supporting people with mental health challenges and so on. So the DDI website's got details of all the projects. There's a really phenomenal range of projects going on to try and look about how we can start to do things better. So just in that particular case, Andrea, in terms of the innovation that you've seen, what would you highlight? When we spoke about this, you talked particularly about the area of super spreaders.
Yeah, so I normally work more in the animal world. And the advantage in the livestock world is that you don't have these confidentiality issues. So actually we get very good data, a lot of data, very good data, and they have the advantage. So they already pool data, movement data, disease data, genetic data. And what we find in the animal world and what is often hinted in the human world as well is the existence. So not all individuals respond the same way to infection, and COVID-19 has shown that. We have these asymptomatic carriers, and we have people who become really ill and die. And so we know there is a huge individual variation in the response. So we need to get away from this count data that are often collected towards individual data. And there I really need to compliment especially Edinburgh, Scotland, because they're starting to collect really valuable individual data and make them rapidly available. So what we hope to achieve is that to understand better what drives this individual variation in the response to the infection. And do we actually also have individuals that account for most of the transmissions? So this super spreader phenomenon seems to be very common, where about 20% of individuals are responsible for 80% of the transmissions. We don't know that for COVID at the moment, but with individual data, we actually can investigate that. So this is really an area going away from the count data to individual data. I see huge opportunities for answering really important questions.
Okay, thanks very much, Andrea. John, where have you seen kind of innovation during the current crisis in terms of using data in much better ways?
Well, I think the CQC has published a list of about 300 innovative changes that have been made during the COVID crisis. They're not all data related. And I think the 19 projects, I think it's 19 that you're funding in Edinburgh are all key to this process. So that's a very positive thing. In terms of some of the things we've been doing in the private sector, we have clearly less access to the sort of personal or medical data than is available in the public system, and that is quite as it should be. But there are some interesting pieces of data being worked on which may be highly germane to the economic recovery after. And partly it's about new systems being developed, and it's partly about using existing data better. So, for example, if we think about what might the retail economy look like as we emerge from COVID, I think there's huge strides been made, for example, by Barclays, who have 12 billion or so data points, which they can assemble from Barclaycard and so on. So it's not going to tell me, David, what you've been putting on your card during the crisis, but it'll tell me or users of that Barclays data what lots of people collectively have been doing. And that will help us in the way that we invest in cities and regions and places going forward. So I think there's a lot of work being done in those kind of areas as well as on the health side. So let's hope this is a great speed up. I mean, the other thing that I hope happens, and I know Tata Consulting in India have been doing quite a lot of work on data there around COVID, but I think one of the things we have to see happen is much more international collaboration on this. We sort of really do need one version of the truth in order to have a quicker response next time something like this happens, because it doesn't happen just within city boundaries or national boundaries.
Good luck with that one, John.
You can but try, right?
Absolutely. Paul, just coming back to you, you talked about the innovation architecture. Are there any areas where you've really seen innovation over the last few months? And where do you think where is the real potential? You've talked in general terms, where's the real potential for data innovation in particular to help us in future?
To carry on the theme I went with before, and the DDI program is helpfully now beginning to turn its attention to this. I do think in transportation and mobility, that there's huge potential. As I said, the kind of way in which people and cities went around their business pre-COVID is clearly going to change, from whether people are walking and cycling more to local high streets than getting buses or trams into city centres, or people are getting in cars and going to out-of-town shopping centres, for example. All of that is going to change. The rhythm of people going into office, the idea of rush hours may well completely change. And redesigning cities, particularly, and it's interesting it's taken us this long to mention this concept, the zero carbon city, because there is clearly a huge kind of zero carbon dimension to all policy moving forward. The kind of zero carbon city has to be a data-driven city. So we have to understand in that transport space, for example, where people want to go to, and when they want to go there, and what's the most efficient and effective way of doing so. And the only way of doing that is by collating appropriate data and then deploying solutions. So, for example, it's not necessarily data-driven, but it can be. somebody from the university was saying to me yesterday, instead of in a Scottish context, instead of people increasingly going from as far afield as Livingston, Dunfermline, further north, Dunbar, further south, etc., into Edinburgh in a way that they used to. Actually, if we set up a series of shared and co-working spaces at hubs across the region, which are conveniently placed for people to be able to cycle and walk to, kit them out appropriately, then, you know, actually that would transform the way in which people get to work and where and how they do their work. Now, it's a great idea. There's only one way you can set that up, that kind of network, is understanding the data of what people, who people work for, where they work, where they live, and then design provision accordingly. So data's got a huge role for me in redesigning how people live, where people, the relationship, if you like, between transportation, the world of work, and the world of leisure, of course, as well. And I think actually we're only just treading our toes into that water, because clearly the effort, including people like me, for the past 3 months, has been the here and now of managing service delivery, completely reshaping public service delivery to deal very much with the here and now. You know, people like me are dealing with, you know, when do we open playgrounds again, and when do we open public toilets again, and all that kind of stuff. We're beginning to get through that to go, right, what do we look like now? What does the world look like? And a kind of a set data sets which allow both public and private sector to respond accordingly is of the highest importance. I don't think those data sets exist in a way that's usable as we sit here today.
Okay, Alessandro, I'll bring you in here. Paul's just saying there we've not necessarily got the data that we need. Matt talked about your high growth business project. You've run into some challenges in terms of that kind of survey fatigue, I think, in terms of actually getting hold of data as the project's progressed. Do you see that as a challenge in terms of that actually collecting meaningful data, particularly from the private sector? Is that a challenge?
Yes, I think as we discussed and Matt was pointing out, our initial plan was to have by now longitudinal data that tells us how high growth firms, not just them, we also looked at, for example, self-employed workers would react to the crisis and would adjust in a dynamic fashion moving forward. But that essentially was impossible because a lot of the respondents in our survey that we contacted, let's say they constitute a sort of core respondents that we use for piloting some of the ideas we have for the surveys. They basically told us that at this point in time, the probabilities that we will get a high response rate were basically zero, because essentially companies are overwhelmed with surveys and people trying to get data out of them. And in fact, I mean, I received, aside from my academic role, I'm also involved with some local high-tech companies in the Edinburgh area, and only I received something like 40 emails of people wanting me to take part into these things over the past 2 months. To be honest, the first 2 or 3 surveys I was interested, but after that it was delete. So basically we decided not to do that. We decided that we're probably going to postpone this to September, October, when hopefully the situation will be a bit better and the waters a bit calmer. But instead, generally speaking, there is this sense of people being overwhelmed. And at the beginning, wanted to tell you things, some of the stuff that Matt was referring to, the unhappiness with some of the measures that the government has put in place, specifically from the self-employed sector. They were extremely critical. But at this point in time, the feedback we got from some of the core key respondents was like, just leave us alone.
Okay, thank you. So there's an interesting question there. It's all very well talking about getting hold of this data, but if we can't get it in the first place from the right people, that's a whole new challenge. Just in terms of another challenge, Andrea, when we spoke, you were talking about clearer protocols or templates, particularly around patient data, that would be much more helpful in your work. That's an area that you've identified where there's an opportunity to do things better.
Yeah, so when we started our project, you know, we were naively thinking we can do a lot, start with publicly available data while we already apply for more private data. And we just found that the publicly available data are actually not very useful to make useful predictions. So we started to apply for existing data sets, identify data, and first of all, we were really joyful because we saw there was immensely good data collected for COVID-19 and many initiatives for specific longitudinal individual patient data. All these data are collected, and we got approval for data access very quickly. The problem we are facing is then getting this data, because yes, of course, there's loads of confidentiality, so you need to involve the lawyers, and there's a bottleneck because everybody at the moment wants this data. So it is a bit frustrating that on one side, these data are there, they are ready to be used, and the philosophy, the understanding that these data ought to be shared is certainly there. It is still getting to this data in the end. There would be an area that if that could be accelerated, that would be very useful. And again, coming back to Leicester, there is no better example than that. You need to act quickly. You need to get this data out quickly.
Okay, thank you. I mean, there's an really interesting point there about which we always come back to when we talk about data, is that balance between drawing meaningful conclusions by using elements of personal data and actually whole privacy issues, and ensuring that there is trust and in the way that personal data is used. One person I interviewed as part of this series said to me that he thought people were happy to share their data where they was seen to derive direct value. So whether that's social media interaction, whether that's online shopping, people seem fine to press buttons and accept cookies and whatever it happens to be. But how do we actually show people that their personal data as used for broader public service delivery? How can we actually get that point across, that there is real value? Because this guy, who is in a fairly senior position in Scotland, said people seem to accept that personal data will be used for better public service delivery, but they're still nervous about that being their own data. So let's say, John, for example, as Legal and General gets involved in this project on care, you know, personal data is important, albeit anonymized and dealt with in all the right ways. How do you show to people that this use of personal data is vital in the long term for better public services?
Well, the bits of evidence that I've seen, and you know, some of it is surveys and some of it is anecdotal, tends to suggest that people are relatively happy about sharing data when they can see a direct personal benefit. They are reasonably content to share it where they see a broader public benefit. So, for example, people who suffer from particular medical conditions will be reasonably accepting of the argument that sharing their data will help other people who suffer from the same medical or similar medical condition. What people are much more distrustful of, and I think I would personally be in exactly this same category, is sharing personal data which may help somebody else make a profit out of it. And that's sort of where the real barrier, I think, exists. And you know, it's been quite a central discussion in the way that we've set up the partnership, if you like, we have with Edinburgh around the ACRC, because we very deliberately went down a route of saying that this would be a highly open-sourced, public benefit piece of work, and the outcomes would be available to all, and therefore we were not trying to extract anything that was proprietary out of it. I mean, we would educate ourselves, but everybody else could as well. I think that's sort of how we tackled it. I mean, it is, I always think, quite interesting that if one assumes that data is suitably anonymized, curated, protected, and so on, that people are, it would seem, entirely willing to go back to the Barclays example, to see future investment in the retail space dictated by the sort of aggregate of 12 billion users of Barclaycard and where they like to spend their money, but much more nervous when it comes to anything in the medical field. I mean, these are not great examples, and I do note you have a sort of full-on session with some real ethics experts around data in a few weeks' time, but I think those would be my observations, and it's something we work around on this one. The last point on it is just from a very kind of directly L&G point, but it affects everybody who's in, for example, the life insurance business in the way that we are. That, you know, at what point do you have access to too much data, and at what point, therefore, do you move from underwriting people for known risks that you know about and they know about, and therefore potentially give them cheaper pricing, when you could perhaps be spreading the risk around more broadly? It's a very live debate, and has been for years actually in the insurance industry, that you know, are you prepared to pay a bit more for your annuity because we think you're going to live longer than most of the population, or should we be making sure everybody pays the same and then just spreading the pricing differential around? These are really tricky issues, and the industry hasn't, I don't think, resolved them beyond kind of a bit of crude postcode pricing and crude things like, are you a smoker or not? Those types of very basic questions. Same is true in property, by the way.
Yeah. Paul, do you have any observations there about how do we show people the value of using personal data for delivery of better public services?
I'm not sure I do have anything more particularly to add. I think a lot of it has been said. I think probably the only thing to add is that, you know, there are going to be some monumental public policy choices facing particularly elected officials actually in the coming period, and we're obviously moving into all sorts of elections in a Scottish context over the next couple of years. So there are going to be some big public policy choices. I'll give you an example, I suppose, of what's in my mind as I was listening to the debate. One of the areas of policy I'm responsible for in the city is housing, and actually relates to the advanced care centre. So without putting too fine a point on it, Edinburgh is perceived to have a housing crisis relating both to supply, there's not enough, and B, of affordability, is too expensive, which is why you see people moving out to different parts of the region, which is why you see increased transportation costs and so on. Actually, a lot of people in Edinburgh are, if I can put it this way, and I'd be nervous of saying this, so I'll choose my words quite carefully. There's a lot of people in accommodation stock which they don't need the full extent of. So you've got, you know, 3-4 bedroom houses which are really kind of designed for families, without families in them for whatever reason, presumably because people have brought up families in those units. Families have left the nest, and people are left occupying them. And actually, we need to redistribute housing stock in Edinburgh more efficiently. We have very little data on that. Very little data on that. It's clearly a very emotive policy area to get into, but actually probably an essential one. Would people be willing to give up? I mean, actually, there's a lot of that data which probably can be collated from council tax register as to how you know, who's occupying what space. So it's perhaps not the best example, but you take my point. You're asking people questions to inform a public policy debate. How can we, from an economic point of view or an economist's point of view, better rationalize existing resources? And we're asking people's personal circumstances to be taken into account and treated as a kind of public policy good, if you see what I mean. I think that can be done, but it's the kind of debate which gets very emotive very quickly, as does healthcare. And it's the way in which the data is then deployed to inform policy choices. So it's not the collation of data itself, it's how it's deployed and how it's used that I think has got greatest sensitivity to it.
Okay, thanks, Paul. We're coming close to the end of time now. I'll just stay with you, Paul, very briefly. you've outlined some pretty serious challenges that you see in terms of how we're using data and bringing data sets together, particularly at a city region level. Do you think we've learned lessons over the last few months that we can take forward? And what positive would you take forward, given that you've identified quite a lot of challenges? And I'm going to come to all the panelists just to give us a positive to look forward.
I think huge opportunities, and actually, nothing spurs people on quite like a crisis. I hear what Alessandro said about consultation fatigue and people kind of being a bit fed up with stuff. But, this crisis has led to new ways of working, which I've not seen in whatever it is, 25 years of public service. So I'm extremely optimistic that we've now got the opportunity for both policy reform and reform in ways of working. But I think we have to grasp those opportunities for reform in the near future. As things kind of move into months and years and so on, there's a risk we go back to where we are. I think we quickly identify the new ways of working required and quickly drive forward reform. I think that opportunity is now, and it's actually a really exciting space to be in.
Okay, Alessandro or Matt, I don't know which one of you wants to come in. Something positive to take forward about data and data innovation from this crisis.
Well, I mean, first of all, to just completely second Paul's comment, many of the companies we speak to are actually now so happy with home working that they're not really wanting to go back to office space, which might be a problem for commercial services providers, but definitely different ways of actually working. Secondly, we're seeing quite a lot of learning going on, which for people who study entrepreneurial systems and ecosystems and innovation systems, we're very excited about. People actually learn about new business models, and they're proofing their value chains, i.e. their suppliers and their customers, to withstand further disruption like this. So I think for a lot of the high growth firms and a lot of the high tech, which is what Edinburgh's actually recently been building its economic success on, this might actually be a very good opportunity and a very positive development overall. And of course, with the caveat that the economy doesn't completely tank in the next year or so.
A big caveat there. John, a quick positive from you looking forward?
Oh, I share Paul's views that it would be a tragedy to waste the crisis, basically, and I'm hoping we don't get a 3-year post-mortem on whose fault it all was, and we actually get on with learning the lessons. We've done probably 3 years worth of tech innovation as a company in 3 months, and lots of others have done the same thing. Picking up something else Paul said earlier, I think we can now focus, hopefully, on the climate piece as an even bigger looming crisis than the next pandemic. And if we can apply the same kind of emergency mindset to it, we'll get a lot done. Data is absolutely central to that at an asset level as well as at every other level.
Okay, thank you. And Andrea, I think you're quite positive about the way that we've responded in the use of data during the pandemic.
Yeah, I want to echo John there, because I think this pandemic has really shown the need to have data-driven solutions and the need to have data quickly. We need to respond quickly because every day we are too slow, costs life. And so the current infrastructure is being set up so that the trends are phenomenally good. And I'm very confident that next time we can respond much faster because we don't need to build up the infrastructure.
Okay, thank you very much, Andrea. Thanks, Alessandro, Matt, Paul, and John. Thanks to everybody for listening in. As I've said, this is part of the wider series. Keep an eye on the DDI website. If you want to come along to the open finance discussion, I think it's planned for the 5th of August. Look out for that. And thanks, everybody, for coming along today. Thanks all for your time and enjoy the rest of your day. Cheers.
Thanks, David. Bye.
Bye-bye.
Thank you very much.